Hello, everyone, and welcome to today's discussion on the topic Suppositories. This is one of the chapter in semester 1 of Bachelor's in Pharmacy program. Now, what are suppositories? As per definition, they are solid or semi-solid dosage forms, usually medicated for insertion in body cavities like rectum, vagina, or urethral tract. Now, when they are designed to be inserted into body cavities, it should also be designed to melt immediately when inserted into body cavities. That is why they disintegrate and dissolve at body temperatures, that is 37 degrees Celsius within the body. Suppositories intended for vagina, urethra, or nasal cavity are also referred to as pessaries, urethral bogies, and nasal bogies, respectively. Distribution of drug from suppositories may either be local for the local inflammation, infection, hemorrhages, or it could be systemic because it bypasses the first pass metabolism. Those drugs which has less bioavailability due to first pass metabolism can be administered through the systemic route. Pessaries are also made as compressed tablets which disintegrate in the body fluids. They are frequently used for local effects, for relief of hemorrhoids or infection in the rectum, vagina, or urethra. And suppository accounts for just 1% of all the medications that are dispensed today. What is the advantage of a suppository medication? When oral administration of a drug is not suitable, as in case of infants, because they suffer from nausea, vomiting, or gastrointestinal disturbance, suppository serves as an alternate route for drug administration. There are advantages in case of local infection or hemorrhoids. Certain drugs like hypnotics, tranquilizers, antispasmodics, etc. are often given as suppositories because they avoid biotransformation by liver, pH conditions, and the GIT enzymes are avoided. Absorption of drugs from rectal mucosa directly into the venous circulation may bring about a faster onset of action as compared to oral administration. Another advantage is undissociated drugs are absorbed more rapidly than the ionized ones. Because in the GI tract, when the drug is administered through oral route, it undergoes several pH conditions before it reaches the site of absorption. In different pH conditions, they are liable to be ionized at a specific pH range depending upon the pH of the drug or pKa of the drug. In general, it is claimed that suppositories and rectal retention enemas may give it drug levels comparable to intravenous injections and provided an allowance of 30-minute delay is there. That means a suppository is considered as equivalent to IV product just with a 30 minutes delay. Now to prepare a suppository, a drug substance is dispersed in a suppository base. So in order to have an ideal suppository preparation, the ideal properties of a suppository base is also desired. Let us see what these ideal properties are. First, it should melt at body temperature or dissolve or disintegrate in body fluids. Second, higher melting point bases may be necessary for eutectic mixtures. Those mixtures where lowering of melting point occurs as a result of impurities or salts presence. Third, it should be inert, non-irritating and non-sensitizing. Like any other excipient which is used in any pharmaceutical preparation, they have to be chemically inert and pharmacologically inactive. It should release the medicament easily, readily. It should be compatible with a broad variety of drugs. It should be stable on transportation and storage. It should have melting and emulsifying properties. It should be able to incorporate high percentage of water in it. It should shrink sufficiently on cooling to release itself from the mold. Fatty bases should have an acid value of below 0.2 and a saponification value in between 200 to 245. Iodine value less than 7 and a small range between melting and solidification points. There are different types of suppository preparations based on the different route or different site for administration. They are classified in different categories. Rectal suppositories, they are meant for administration to the rectum. They are tapered at one or both the ends and usually weigh about 2 grams each. Infant suppositories usually weigh about 1/2 that of the adult suppositories. All sedatives, tranquilizers, and analgesics are administered through rectal suppositories. If it is administered to the vagina, they are known as vaginal suppositories or pessaries. They are globular or oviform and weigh about 4 grams to 8 grams. Urethral suppositories, they are cylindrical dosage form, having a diameter of 5 mm and a length of 50 mm for female and 125 mm for male. Weight for urethral male suppository is 4 gram, while female is 2 gram. If it is to be administered to the nasal cavity, they are known as nasal bogies. They are same as urethral bogies, however, thinner, not more than 8 mm in size, and weigh about 1.2 gram. In dispensing practice, nasal bogies are prepared from gelato-glycerin base. This is the water-soluble base. Ear cones, if they are administered into the ear cavity, and they are rarely used. And if they are prepared from cocoa butter. Now to prepare the suppositories, the ideal properties for suppository bases we studied. Now as we studied the classification of suppository preparations based on their intended site of administration, suppository bases can also be classified depending upon their solubility. So they are oleogenous bases. This is the first category. Now this is not water soluble. Oleogenous bases is theobroma oil or cocoa butter. They are oily bases, and theobroma oil is the other name for cocoa butter. It was introduced as a base in 1852 and has been one of the most widely used bases because it satisfies most of the criteria for an ideal suppository base. But it has a very low melting point, that is 32 degrees. That is not desirable because even the body temperature is 37 degrees. And overheating of a theobroma oil alters its physical characteristics. So care has to be taken in order while preparing a suppository preparation that indirect heating in a water bath should be done. Direct heating in a flame should not be done because it causes a change in the characteristic of the cocoa butter because they exist in different forms. And sometimes it is not desirable to have gamma form or any other form. And if there is a change in form, it is also having a tendency to stick to the mold when it solidifies. And it exists in 4 different forms, that is the alpha form, beta dash form, and gamma form. So these are the different forms in which theobroma oil or cocoa butter exists. These are different forms and different forms have different melting points. So aqueous bases. This is the second classification of suppository base. First was oleogenous bases, second is aqueous bases. Now aqueous bases examples are glycerol, soap glycerine, PEG bases. So glycerol, Gelatin it's also known as glycerol gelatin. It's a mixture of glycerine and water made into stiff jelly by addition of gelatin. Glycerogelatin bases dissolves in body fluids, liberating contained medicaments. Glycerine suppositories being liable to mold growth, preservatives is desired to be added in the formulation. Soap glycerin is also another aqueous base. Soap is employed instead of glycerin for hardening sodium stearate and can be incorporated up to 95% because it can sodium stearate, hardening sodium stearate, as it can be incorporated up to 95% glycerine. Soap glycerine contains 95% glycerine. PEG bases. Some important PEG bases used in preparations of suppositories are PEG 1000, PEG 4000, PEG 1540 and PEG 6000. These are all solidified PEGs. PEG 400 is a liquid and PEG 600 is also solid during winters and they are liquid during summers. But however, PEG 1000, 4000, 1540 and 6000 are all solidified bases. The third category of suppository base is emulsifying bases. Examples: massa asternum, vitebsol and masipol. They are the trade names under which the emulsifying bases are marketed. And massa asternum is a mixture of mono, di and triglycerides. Now those were the categories, different categories, classification of suppository bases. Now after studying what is the definition of a suppository, what are the advantages of a suppository preparation, different examples of a suppository preparation, why they are prepared, classification of suppositories, classification of suppository bases, let us see how the suppositories are prepared. The simplest method of preparation of suppository without the use of any instrument equipment is hand mold suppository. This is oldest and most simplest method. Here, mix the measured quantity of medicinal substance with sufficient quantity of cocoa butter, triturate it, and if required, it can be diluted with or softened with alcohol. Add the remaining quantity of theobroma oil or wool fat if in case 2% wool fat can be added in case of desired consistency is desired to be obtained. More solid consistency is to be obtained. Wool fat can be added. When the mass becomes plastic or by vigorous kneading of pestle, then it is quickly removed from the mortar with a spatula. Now, the spatula containing the material is transferred to filter paper and keeping in hands during the kneading and rolling procedure, the rolled mass is now placed on the tile and the hands have to be continuously rotated so as to make a roll of the mass. Rolling the mass on the tile with a flat board forms a cylindrical suppository. Now this rolled mass is then cut to pieces by the spatula. The pieces are then given rolled shape on the tile itself and then they are packed in butter paper or in a proper container and stored in a cool place. So this is a simple method of trituration in a mortar and a pestle. Simply the drug substance is mixed with cocoa butter. If required to be diluted, alcohol is added. If required to increase the consistency, wool fat can be added. And then vigorously they are kneaded. After kneading, the entire quantity is collected with the help of a spatula. And then with the help of the spatula, it is placed on a filter paper. A filter paper is used to make a roll out of that material. And then the roll material is placed on the tile to further roll it. During rolling, the spatula is used to cut to pieces. This is the crudest method of preparation, which is no more in use because it is not an accurate preparation. Second is compression mold suppositories. In this, the mold is shown in the right side figure. Here, mix theobroma oil and drug The mixture is forced into a mold under pressure using a wheel-operated press. The mold is removed, opened and replaced. On large scale, cold compression machines are hydraulically operated by water jacket, cooling and screw fed. So this is just mixing and using pressure it is forced into the molds. Third method of preparation is fusion and melt mold suppositories. The drug is dispersed or dissolved in a melted suppository base. The mixture pour the mixture into suppository molds and allow cooling in ice bath. The finished suppositories are removed by opening the mold. So here cooling is done in ice bath. So once the prepared drug and suppository base drug is dispersed in a suppository base by trituration, the mixture is then forced into the mold, and then after adding to the molds are placed in ice bath to solidify, and then suppositories are removed by opening the mold. Now there are different types of molds that are available. They are of aluminum alloys, brass or plastic, and are available from 6 to several hundred cavities depending upon the size and scale of manufacture. Now this is fourth method, which is automatic mold machine. This is used for large scale production of suppositories. All filling, ejection and mold cleaning operations are fully automatic. The output of a typical rotary machine ranges from 3,500 to 6,000 suppositories per hour. The suppository mold is lubricated by brushing or spraying and then filled to a slightly excess. That means any oil can be used for lubricating the inside of the molds, and the filling is done. The filling always is done a slightly excess. And when it solidifies, the excess is scraped off from the top of the mold. Okay, and then their excess material is reused. Now that was the manufacturing method for suppository preparations. How the formulation is prepared, how the calculation is done to add the right quantity of the base, suppository base, we have to understand the concept of displacement value. Now what is this word displacement value of medicament? What does it mean? It is the quantity of medicament that displaces one part of cocoa butter, and it is known as displacement value. The volume of a particular suppository mold is uniform, but fill weight will vary according to the density of the medicament as compared with cocoa butter, with which it is calibrated. Now, before preparation of a suppository, all the molds are pre-calibrated with just the suppository base to check the amount of fill that goes inside one particular mold. Now, then it is mixed with drug and the final preparation is accordingly made, because we get to know the weight that will be accommodated in that particular mold of that particular volume. However, it is not that simple, because different medications will have different densities. So it will vary from medication to medication. So the 1 gram of the medicament will displace a different quantity of cocoa butter than 1 gram of some other medicament. That is why this is known as the displacement value, which varies from one medicine to another. So this medicament displacement value is very important in preparation of any suppository. If the value is known, well and good. If the value is not known, it is to be calculated. Let us see how the displacement value is calculated. Determination of displacement value. Weight of 6 suppositories of theobroma oil or any other base is equal to A gram. Then weight of 6 suppositories containing 40% of drug is B gram. So now, without any drug, if the base was filled in on the suppository molds, the weight of 6 suppositories, that means the total weight of all the 6 suppositories when they solidified, when they were taken out, the weight was A gram. Now when the suppository, all these were filled with 40% drug, it was V gram. Now calculate the weight of theobroma oil. That means if it is 40% is the drug, so 60% will be base, that is theobroma oil or any other base. So 60% of B, because the total weight is B, so it will be drug plus medicament. Now the total weight is B and 40% is drug, so 60% will be base. So 60% of this total weight, let us see, it is C gram. Let us consider it as C gram. So this is the weight of theobroma oil and this is the weight of total suppository containing the drug plus theobroma oil. So now, and for drug it will be 40%, that is 40 by 100 into total weight of the suppository containing both the drug and the base. So it is 40 by 100 into B, that is equal to D. Now this is regarded as D gram, this is regarded as C gram. So now A minus C, that is a base without any drug and a base with drug. Here this is a base without any drug, base with drug for that same mold, suppository mold. So this is A gram, this is C gram. If you minus both of them, what will it give you? If you minus A from C, it will give you the weight of base or theobroma oil, in this case, that has been displaced by using 40% of the drug or D drug. So the displacement value of the medicament will be D, that is the amount of drug that is present in the formula, divided by amount of base that it has been successful in displacing, that is nothing but A minus C. So this is a displacement value of a suppository preparation. It does not have any unit because this is also in gram and this is also in gram, so it is unitless. So this is displacement value of a medicament which varies from one medicament to another medicament. This is the formula states, that is the concentration of drug divided by the amount of base that it has been successful in displacing. That is the mold containing theobroma oil or any other suppository base minus the mold containing the same quantity of drug. So this will give you amount of base or suppository base or theobroma oil that it has been successful in displacing. So weight of the drug divided by the weight of the theobroma oil they have displaced. The same quantity of drug, the weight of theobroma oil, it has displaced. So it is a ratio and this will give you a displacement value. Using this value, suppository formulation can be prepared. Let us now see packaging and storage of suppository preparations. Suppositories are packed in partition boxes or in tightly closed screw-capped glass containers or wrapped individually in aluminum foil. In large-scale production, suppositories are wrapped individually or separately in foil packs. And candy wrapping is more familiar. Aluminum foil or PVC polyethylene strip pack is also there. Low melting point suppositories should be stored in a cool place and theobroma oil suppositories should be stored in a refrigerator. These are some examples of the marketed preparations of suppositories. Lalcolex, it's for infant use, prepared by the German remedies. It contains bisacodyl in suppository base. 5 mg. It is an irritant and rectal evacuant. Dalcolex is also prepared for adult, prepared by same company, German remedies. It contains bisacodyl in suppository base 10 mg. Conlax, prepared for adult. They are prepared by Bliss Pharmaceuticals and they also contain bisacodyl in suppository base. They can be either 5 or 10 mg in a suppository base. Pessaries examples are Vocodin, prepared by Vocod, contains povidone iodine 200 mg. Candizole tea, which is prepared by Labs, contains a mixture of antifungal and antibacterial agents like tinidazole 500 mg, miconazole nitrate 100 mg, neomycin sulfate equivalent to neomycin 20 mg. It's an antifungal preparation prepared by Labs. It is a pessary prepared for vaginal fungal infection. The other marketed preparation examples include stinicide V pessaries, which is prepared by Blue Cross Laboratories, contains clotrimazole 200 mg, tinidazole 500 mg, Imidil vaginal tablets, which is prepared by Likes Lab, contains clotrimazole 100 mg, betadine pessaries, prepared by Win Medicare, contains povidone iodine 200 mg, and Canesten vaginal, which is prepared by Bayer India, contains clotrimazole 100 mg. So now these are few informative videos on the topic that demonstrates how the suppository is prepared in a lab or an industry, how they are packaged. Please watch them at your leisure. Thank you for listening. Have a nice day.